Good afternoon, colleagues, and welcome to our joint webinar today. My name is Kerry Mangold. I'm the Program Director of the South to South HIV Prevention Learning Network, and I will be the chair for today's session. The webinar today will be on engaging the private sector in health programs. Together with my colleagues, Maureen, who leads the Sequin Network, and Esther from the Behavior Change Accelerator, we welcome you really to this important session and to listen to and engage with our distinguished speakers. As we know, achieving global health targets, particularly in areas like HIV prevention, requires an approach that goes beyond the public health sector alone. With shifts in global health funding placing greater pressure on national budgets, it's crucial that countries explore domestic resources to bridge these gaps. The private sector represents a vast and largely untapped partner whose involvement can bring significant resources, strategy, innovation, insights, and efficiency to our health interventions. So the webinar today has three objectives, and really we wish to explore practical strategies and examples of how we'll work with private sector and public sector in our African countries. So over the next 90 minutes, our goal is threefold. First, to share in evidence and real-world examples of successful private sector engagement models. Secondly, to deepen our understanding of the essential strategies for effective public-private partnerships. And thirdly, to identify opportunities and recommendations for fostering greater private sector involvement, particularly in HIV programming. Before I move on to introduce our first speaker, I want to please ask that everybody on this webinar today, please go down to the bottom of your screens and select your preferred language. Please, for the English speakers on this webinar, please also select English, as there will be some presentations which may take place in French. And so we don't want a disruption at that point in the webinar. So it is my real honor to introduce our first speaker, who will be providing our official opening remarks to this webinar. I would like to invite Dr. Temitope Ilori. She is the Director General of Nigeria's National Agency for the Control of AIDS, and she will be sharing opening remarks on private sector engagement in Africa. Dr. Ilori, over to you.
Yeah, good afternoon. I hope I'm visible and audible. Yeah, it's a pleasure to be with you this afternoon. Thank you so much, and I'm pleased to join the webinar on the private sector engagement in health programming across Africa. I want to start by thanking the South to South Learning Network and the Behavior Change Accelerators for putting this together. And I appreciate all the participants for coming on board and joining this discourse this afternoon. As you all know, Africa has made very remarkable progress in HIV prevention and treatment. But as the Global Fund continues to decline, we need to actually sustain these gains, and we have to be intentional in our approach, and that involves involving the private sector in going forward. Definitely government alone cannot meet all the needs of our citizens, and we know the private sector has very rich resources. They have the innovation, they have the reach, so they have quite strategically positioned to play a central role in scaling up solutions. We need them to strengthen our system. We need them to extend services to commodities, and commodities to those that need them the most. And we also need them to help us to improve our healthcare delivery system to ensure access to quality and affordable life-saving products, and as well as capacity building for our health workers. So government in Africa obviously needs to create the enabling environment by developing the necessary policies and regulations that will guide, and that would also encourage private sector participation and ensure that we have improved service delivery. So to make our programs across Africa very sustainable, we need to work hand in hand, with the private sector, and it's very important that government, takes that leadership. Across the continent, we are beginning to see some inspiring examples, in private sector involvement in health programs and digital platforms, in engaging young people, and also the supplies and provision of commodities and health services across the continent. So I believe that this forum today will give us the opportunity to learn from one another, to share experiences across the continent, and to explore, how to create the necessary enabling environment for stronger and more sustainable partnership. So I look forward to us, sharing insights regarding all this and coming up with actionable recommendations for governments and partners, and the private sector to be able to work together, and share responsibilities and collaboration. So I thank you all for this invite, and happy deliberations. Thank you.
Thank you so much, DG, for those really wonderful opening remarks and reminding us that we do indeed need to walk hand in hand, and we appreciate your leadership and being here to really set the scene for this exciting webinar. So we'll move to the next presentation, where we will ask Esther to give us a global perspective on private sector engagement in health. Esther is the co-host of this webinar from BCA, and she is also a global health professional with almost a decade's experience in managing public-private partnerships to advance health objectives. So Esther, the next 5 minutes are for you, and you may take over.
Thank you so much, Carrie and DG, for those wonderful welcoming remarks. And hello, everyone. Greetings. Maybe just to say a little bit about the Behavior Change Accelerator. It is a cross-sector partnership that deploys private sector expertise to provide market research, tech expertise, creative design, strategic marketing, all areas of expertise of the private sector to support HIV, TB, and malaria programming. And as Carrie mentioned, I'll be speaking today around a few key trends that we've been seeing as the BCA, and these include aligning health partnerships with corporate objectives, leveraging the strengths of local and global private sector partners, thirdly, integrating private sector expertise into existing initiatives, and lastly, deepening our usage of technological innovations as well as AI. Next slide, please. So in terms of key trends, I'd like to start with aligning our corporate strengths with the global health needs. So one thing that we do know that we've seen over the past year and a half as the Behavior Change Accelerator is that corporate contributions are most impactful when they align with a company's core competencies. So whether that's logistics, digital engagement, consumer analytics, we're more likely to be able to engage the private sector productively when we think about what they do really well, and bringing the ask around what they do very well, as opposed to something that's outside of their core business objectives. And that is how we're able to create that shared value. And as the Behavior Change Accelerator, that's one of the areas of support that we're able to provide, is being able to create that shared value. Secondly is around the complementary role the global versus local partners can play. And so our global partners oftentimes are multilateral, multinational organizations can bring sometimes funding, technology, or free services, platforms that have immense reach, but some of that is not always adapted to local realities. And that's where the opportunity for bringing in our local partners can be most valuable, because they're able to bring in that contextual expertise and networks that can complement what the global private sector partners are bringing in. And once again, the BCA is able to help with kind of balancing those contributions from the local and global side. But there is value in setting up partnerships that bring in all of these, both of these different perspectives. Next slide, please. And so what we've also found to be really valuable is around plugging into what already exists. So oftentimes companies don't have the skills or the relationships within the public health system to design or deliver an end-to-end program. So it's not going to be really effective for us to go to Coca-Cola, for example, and say, can you help design the entire health supply chain for the deployment of LEN, for example. But what we do see to be most impactful is when we go to the private sector and we say, here is a gap that we need you to fill. So for example, I have Coca-Cola up here, and I know that Phil Roberts is going to be speaking to Project Last Mile, but because of the Coca-Cola company's expertise in supply chain, strategic marketing, they're providing that expertise to support and strengthen health program delivery. So as opposed to them actually doing the health program work, they're plugging into and supporting a need there and utilizing their expertise. And then finally, the issue of technology and AI. There's so much incredible innovation happening right now in this space. And AI, for example, is able to deliver prevention, demand generation messages that are timely and tailored. And those can come through chatbots, SMS, dating apps. We'll hear a bit more about dating apps as well in the coming parts of this webinar. But there is a role for us to think about how we can leverage the private sector to tap into some of these technologies and some of these tools. And then if we can go to the next slide, please. And so finally, in terms of the BCA's contribution, we see our key strength as being a neutral partnership broker to really bring together both the private sector and Ministry of Health at large and support them in being able to find that shared value. Part of our role is also around evidence packaging, so helping us to distill results, whether that's from a pilot project, distilling those results from those pilots into tangible insights that can help us understand what the value of actually partnering looks like. We can also help you think about what scaling up looks like as well. So again, even if we're starting small, what does it look like to scale up efficiently? And so finally, we also are able to support with a small amount of catalytic funding that helps kind of de-risk private sector coming in to support Ministry of Health and at least start that engagement. And so I'll leave us with this, and that is the fact that we do see as the BCA the future of prevention lying in integrating both the digital demand generation with new biomedical tools such as long-acting PrEP and injectables. And there's an immense value that corporate and technological partners can play in supporting this integration in partnership with government, especially to expand reach as well as reducing costs. I know that was very quick, but look forward to the further discussion here. Thank you so much, and over to you, Carrie.
Esther, thank you so much for helping to set the scene. And it's also great for everyone on the call, I think, to get to know you. And we really welcome you as a partner to Sequin and SSLN. I noticed you didn't have your contact details on your slide, and I'm sure there might be many people interested. So if you're open to it, will you pop your email address in the chat? Of course, we are happy to facilitate any follow-up discussions, but if people want to get in touch with you directly. So we'll move on to the next presentation, which will be given to us by David from the Global Fund. David will be focusing on policy and enabling environment for private sector collaboration. So David is a portfolio manager at the Global Fund and draws on over 2 decades of experience in the private and philanthropic sector to support impactful health partnerships. David, it's a pleasure to have you with us, and the next 10 minutes are yours.
Thank you so much, Carrie, and hello, everyone. Delighted to be with you, and greetings from a sunny Geneva. It's always a bit funny to have somebody from Geneva talk about the policy and enabling environment of things. The Global Fund, thank goodness, is not a normative agency, but what we can do is perhaps, what I like to do is take you through a bit of how we position the Global Fund partnership, which, as you know, is around donor governments, implementing countries, community organizations, civil society organizations, people affected by the disease and technical partners, and of course the private sector, how we position that whole partnership when we do speak to the private sector. And again, this is not it's not a scripted approach, but it's more on the collective experience we've had so far within our kind of interactions. Next slide, please. So I'm sure you all know the Global Fund. You've seen our latest results report that came out, and it is really around having that collective impact at scale and saving those 70 million lives and having that impact via our kind of unique model, which really puts countries and people in those countries and patients really at the center. We know global health, like other things, has often been kind of dictated as a North-South relationship. We were created exactly to create a kind of different model. We're not perfect, but we're hoping that, and we've seen, is that our legacy will be that of really putting countries in the driving seat and enabling them to make the right choices with the best possible experiences and best possible knowledge that they can around this. And this also goes around how we partner with the private sector. Next slide, please. One of the things that we like to stress when we talk to donors that are not government donors, and these are donors that might come from multilaterals, it might come from corporates, it might come from multinationals, they might come from foundations, high net worth individuals, grassroots organizations, that our impact is beyond the three diseases. When you tackle things, epidemics like HIV, TB, and malaria, and you tackle it from a health system perspective, and you do that using on-the-ground solutions, you're actually impacting a lot more. You're investing in human resources for health. You're promoting people-centered integration around this, so beyond the three diseases. You're building stronger community response systems. You're strengthening data systems, data use, and of course, you're improving overall procurement and supply chains of all health commodities. Next slide, please. This impact collectively has shown some fantastic, remarkable results when it comes to basic longevity of countries where the Global Fund partnership has kind of worked. People are living longer, they're living healthier lives, they now have other health concerns, but it is a great kind of opportunity for the private sector to look at the impact in terms of what investing in health actually does. Next slide, please. So, and one of the things we do like to position ourselves and our narrative around is by investing the enormous amounts of money that our partnerships has invested over the years, you unlock economic value. So how we can, sorry, Carrie, you want to jump in? Am I going too long?
Sorry, no, you're going a little fast, David. Just a little slower, please, for the
Slow down.
interpreters.
Sorry, I have lots of sliding. As you can tell, this is an exciting topic for me. So one of the things that we like to narrate around the success of our partnership is around the economic value that these investments have unlocked. And this means people are staying, are not being affected by the diseases, they're living longer lives, they're able to turn themselves into productive citizens and participants of the local economies. Next slide, please. How we partner with the private sector. So we see the private sector essentially as being a key driving force within the Global Fund model. We have mobilized in our 20-year plus history over $5 billion of financial assets from the private sector. We see the private sector as being different than our big G7 donor governments, because what we do see where we see private capital and private interventions is in terms of addressing key bottlenecks in global public health. So, and by combining their catalytic role, their catalytic funds, their catalytic capabilities, and bundling that within the Global Fund kind of scale and impact, we're hoping, and we try to address some of those key challenges around global public health, which we know is around reaching people at the last mile, which is around making prevention more effective, which is providing medicine at a lower cost, which is really making sure that medicine does not expire in warehouses. And all this really maximizes the impact of our programs, of our partnership, and of what the private sector's donation to us is. Over to the next slide, please. We essentially partner, we try to leverage the private sector for all its many kind of assets and capabilities. First of all, mobilizing resources. Private sector does not have billions, it might have millions, but they are very keen around creating that shared value approach. And by engaging those millions to make the billions more effective, if you will, so using catalytic mechanisms that address some of these key bottlenecks, things like community health workers, or lab system integration, or last mile distribution, these are the themes that we work on. Then we kind of make the global fund investments with our country partners more effective, but we also have a fantastic return on investment and impact at scale for our private sector donors. The other element is around financial innovation by bundling pooled funding around specific areas, such as debt to health, and keeping co-financing agreements and the such. We're able to kind of bundle and risk mitigate some of these investments around it, particularly around the introduction of new medicines, such as SSLN, that you might be aware of. So that's the kind of financial brokering that we engage on. This third bit around delivery innovations really is super exciting. The private sector has a unique capability set, and it has that reach, as Dr. Laura was saying. It has that capability in last mile distribution around demand generation, and also has this tradition around empowering consumers that we can all learn from the public health perspective. So one of the things that we engage with the likes of Coca-Cola, Johnson & Johnson, or Orange is around agreeing on a public good, if you will, collaboration with these companies, and translating those kind of competencies into public goods for the likes of our in-country partners to access. Last but not least, the private sector is also a very important actor when it comes to local and donor government advocacy. We have seen that increasingly our major donors are looking to see how we engage with the private sector, but also bringing the private sector voice to our governance mechanisms and to our donor community is quite important as well. So that is something that we also engage in. Over to the next slide, please. As I mentioned before, we have a wide spectrum of private sector partners. They include everything from the mining industry to fast-moving consumer goods to faith-based organizations and pharmaceutical companies. Next slide, please. To give you a bit more data in terms of how we are funded, so you see here the split around our collective contributions from the private sector. As you can see, it's mostly from foundations, including the Gates Foundation, pharmaceutical and diagnostics, but also growingly the ICT community, extractives, and faith-based organizations as well. We also have a number of in-kind partnerships. Our average partnership duration is quite long-term, 9 years, which means we're delighted that we are able to engage selectively but strategically with our private sector donors. We have a team of 13 people. Next slide, please. We've seen, as Esther mentioned, we've seen an evolution in terms of how the private sector is kind of engaged traditionally with the Global Fund. And I can take you through some examples of that. In terms of corporate partners, what we've seen is that corporate partnerships have evolved from a simple, often transactional relationship to one that is more complex and strategic collaboration focused on shared value and mutual benefit. So the initial partnerships were often limited to philanthropic or supplier agreements or companies kind of cutting a check for a cause. Afterwards, I think the next step was around really creating those emerging strategic partnerships where you partnered along a company's kind of value chain and footprint. Then there was a bit of an extension around shared value. What we're seeing today is that we're seeing a growing expansion in terms of partnerships types that we're having with corporates, often involving kind of crafting, leveraging partner platforms and leveraging actually the network of the company to make this more effective. A typical example is how we engage with Coca-Cola via Project Last Mile to really engage the local Coca-Cola bottlers to bring their expertise to the fore. We've also seen a similar, next slide, please. We have also seen a similar evolution from our foundations, from our contributions from foundations. So partnerships with foundations, I think my perspective is that they've evolved from a transactional kind of grant making to more strategic, collaborative, and impact-focused relationships. We've seen now that working together and co-creating these partnerships on the ground with our in-country actors really creates that kind of space to be not only to be very grant focused, but also builds that space where we're focusing more on impact and less on what the mechanics of that is. This evolution includes moving towards more of a trust-based philanthropy, where foundations are offered more flexible funding and build stronger, more equitable relationships with grantees. And the Global Fund tries very much to, by being a kind of a pooled funding mechanism for these foundations, tries to bring that impact at scale, while hopefully reducing some of the burdens around reporting and the such. Next slide, please.
David, would you mind wrapping up in the next 30 seconds?
Very quickly. So some of the motivations that I have shared here in terms of why the private sector chooses to collaborate with the Global Fund and its in-country partners. As you can see here, there's some common data sets as well. Next slide, please. Almost done. Next slide. So some key lessons learned. I think here really nothing new under the sun, but just to put it all on one slide. One is that shared value drives sustainability. You need to find that sweet spot between what the private sector wants, what the country wants, and what that common need is. Clarity of role and expectations is very important. I think it's very important also open up to co-creation, leverage each other's complementarities. Trust and transparency is important. Long-term vision over short-term gains, data and metrics matter. Last but not least, country ownership and leadership buy-in and financial sustainability is key when entering those things. Thank you very much. Apologies for running over.
Thank you. Thank you so much, David. I think this slide in particular resonates with me a lot, and I'm sure a lot of our audience. And I think the importance of kind of articulating what the shared vision is in order to achieve the impact. And so I think this is a really nice segue. You also mentioned PLM. We're going to move into the section of the agenda where we are going to hear from four organizations. We're going to hear some country examples of private sector in action. So we are going to move straight into Project Last Mile, where I will invite Phil to share with us the experience. That I can ask Phil to share experience. I'm going to slow down on the bio so we can save a minute or two, but Phil, over to you.
Thank you very much, Kerry, and thank you and welcome to all the participants in the webinar. It's an absolute pleasure to be chatting to you. And yes, Kerry, David's last slide, I think, can be replicated across every one of our presentations. It's all very relevant. So I'm going to chat to you briefly about 10 years work in the health space, leveraging a lot of private sector intelligence data, landscaping analysis, and IP. So let's quickly hop onto the next slide. Project Last Mile has, since 2009, in fact, been very active in a lot of markets around the continent. I'm hoping that some of you might recognize or be part of some of the programs that we managed in some of the markets. We have, over the last 14 years, been involved in 47 projects in 17 countries. Obviously, with the withdrawal of the USAID funding, some of those have slowed down. I will talk now mostly about the Southern African context, where the centralized chronic medicines dispensing and distribution project is still very active. Next slide, please. So why did we go here? Why did we do a public-private partnership in the chronic medicines, in particular HIV, going back to in 2014 in South Africa? And it was exactly the reason that most countries would face. It's about decongesting health facilities. It's about making the medicine more available. And more importantly, it's about giving our patients the agency to look after their wellness and not hold them ransom to a prescription every 30 days in a public healthcare facility. But the public health space also has limitations in terms of the number of people it can deploy to reach communities. So that's where Project Last Mile, using its experience in the private sector, was able to broker a partnership with the Ministry of Health and with the private sector partners. I think also a disclaimer here is that we are very fortunate in South Africa to have a very mature retail market, and also to have a very robust infrastructure to be able to reach most of the places. The private sector and the public sector are driven by the same need. The one is to make sure that we make it as easy as possible for people to be tested, and then for people to be initiated into care, and then more importantly, for people to stay adherent and not drop off treatment. And that has been a fundamental aspect of the success of the public-private partnerships. And there are some numbers I can show you on the next slide. So, you know, the big jump in this obviously was we all experienced that period during COVID where we were in lockdown and people were prohibited from traveling. And that's really when the CCMDD program, or as we call it in the local colloquial term, double up meds, which means a shortcut to your medicine. It grew 98% over that time. And we had an accelerated growth of pickup points. So you may ask, well, how does it work? A patient who is either adherent, virally suppressed, and doesn't have any complex comorbidities would be asked if they would like to register on the program at the clinic or at the public healthcare center. They are then recruited onto the CCMDD program, and they have a choice of where they can collect their medicine every 28 days. And that medicine is then dispatched through a regulated courier, through an e-prescribing system, goes through a private sector courier. All the regulatory elements are adhered to with regards to the Pharmacy Controls Medicines Act, etc. And the medicine is delivered to the preferred point of pickup. And that could be on the way to work, at work, in a mall, in a community, etc. So it's really very patient-centric. And as I say, there 64% of the patients collect their medicine at external pickup points. It takes them an average of 10 minutes. Now, I think you've all pretty much experienced how long it can take for a person just to get a renewed prescription at a public healthcare facility, if the medicine's available, if there's somebody to issue the prescription, and of course, depending on the number of people there on the day. We have nearly 3,000 pickup points. And by the way, this is all paid for by the Ministry of Health. So it's not as if it's a donor-dependent program, very, very critical. This is a mechanism that is funded by the National Treasury because they see the benefit of well patients rather than second-line patients being admitted into higher care and or hospital. And 40% of all of our patients, we have just on 6 million HIV patients on medication, and 40% of those receive their medication through the private sector pickup points. who earn a fee, by the way. So it's not for free. They also earn the equivalent of about 11 Rand, whatever that is in dollars, just short, probably about 60 cents per parcel that they hand over. And they get the foot traffic. So it's a quid pro quo. Next page, please. So just some lessons learned, besides the page that David put up. I think it's absolutely critical that you have strong contracts with very defined service level agreements. And of course, you need the standard operating procedures, so there's consistency. How am I doing, Kerry? 1 minute. We need to have those mechanisms to monitor, and even more so now when we don't have those data folk that were deployed by the NGOs with USAID. It always starts slow. We had and I can show Uganda also as an example, but it scales very, very quickly. You need to have the electronic tools to track and trace. You need to make sure that you have a closed loop system where you track prescriptions and parcels, because that's the one thing you don't want to do is lose medicine or lose patients. We need to have that spread and universe of pickup points that suit the accessibility of the patient profile. And of course, we need to have a contracting mechanism developed by the government or the Ministry of Health that is easy and universally applied. And a patient needs to make a choice, and it needs to be patient-centric. And it is a true example of a public-private partnership, and we want to grow it beyond HIV. We want to go into preventative health and into family planning to give it more reach in the communities. Thank you, Kerry. Thanks, everybody.
Thank you so much, Phil. That was really, really interesting, really great example, I think, from South Africa and from PLM. Colleagues, please forgive me for not giving the instruction of how we would like to deal with questions and answers in this webinar. If you look at the bottom of your screen, there is a Q&A function, and I would like to encourage everybody in the audience to use that Q&A function to put their questions. You can say which speaker you are addressing it to, and they will respond while the webinar is ongoing. But we are hoping to have a period of time at the end of the webinar to also take some Q&A. But please, if I can encourage you to use the Q&A box in the meantime. We are going to move to our second country example, which will be given by Steph, who is a senior manager at Grindr for Equality. So I will hand over to you, Steph, and you've got 10 minutes.
Hi, everyone. I'm Stephanie Opari, they, them pronouns, and I'm really excited to talk to y'all today about Grindr and the digital resources that we're able to share with our community. Next slide. So for those that may not be familiar with Grindr, our core mission is to become the digital gayborhood in your pocket. And what that means is that we understand that a gayborhood or a gay neighborhood may not be available in all areas of the world. And we want to utilize our platform to connect the LGBTQ community directly to services, resources that exist around them that they might not be familiar with because they might just be coming out. They might not be comfortable, going to clinics yet. And in many cases, especially in the region, because of fear of criminalization, they may not be looking for these services very often and depend highly on word to mouth on where they can find access to HIV and STI testing. Next slide. So Grindr for Equality, which is the social impact initiative at the company, was built on a very powerful idea. What if the same app that people use to connect with their community can also connect them to life-saving resources? And a decade ago, we did just that. And the first messages that went out were specifically to users in Syria during the refugee crisis, connecting them to exactly that, condoms, HIV services, and more importantly, to peers that were able to support them navigate those difficult times. And the engagement rate was so high that we said, Why not try to do that in other countries? And now we have messages that go out to 190 countries and throughout the region as well. So again, it's for me in the past 3 years that I've been in the company, one of the most powerful tools that I believe the community has to building spaces and mobilizing their communities. Next slide. So just to share a little bit about Grindr for Equality, we have 3 commitments at the company. Equality before the law. We don't believe that anybody should face arrest or police harassment simply for being who they are. Marriage equality. Everyone should be free to marry and love without restrictions. And equality in health. LGBTQ people should have access to healthcare that respects their identities and their unique needs. We understand that beyond connection, we are a true platform for justice, and we want to make sure that our community feels safe in all aspects of their life, because we know a safer community is a healthier one. Next slide. And we know the community is on Grindr. These were stats that were shared back last year, but since just a year, from 13.3 million, we're actually at 14.5 million monthly active users around the world. And the number that always stays with me is that 58 minutes of the day is spent on Grindr. That's more time than someone would usually spend even on Instagram or Facebook. So we know folks are there. And for us, in terms of partnerships, it's an entry point, right, for people to connect to all the resources that are out there. Next slide. So for those that are very new to the app, how does it work? When you open the app immediately on the first slide, you'll see a cascade of different users, which just means it's 100 different people that are around you and that you can connect with. The second one is the inbox, and that's kind of the area where you're receiving messages, not only from people that you may be talking to, but also from us. And that's what we're going to go deeper into today. And then, of course, the chat function. Next slide. So at Grindr for Equality, we want to make sure that we are sharing resources through the ads space that we have available. And what kind of resources, right? That could be a little bit of everything. It could be, again, on the health side, HIV, STI testing, PrEP, but also mental health services, specific trans and non-binary support, services for migrants as well. We know that we have all types of needs, and these are resources that people rely on daily. Next slide. So the types of ads that we're able to provide, and all of these ads, the important part here is that they're free for our partners. This is not just advertising, this is impact. And we look at this as a way that pop-up messages will appear to a user as soon as they open Grindr. And these are quick, text-based, sometimes even urgent messages, right? When there's mobilizations happening, but also when there's health outbreaks, letting folks know where they can get testing. And even, thinking back during COVID, we used this to also connect them to vaccination sites during NPOX as well, letting them know which clinics were actually going to be open and available to them. And here as well, even during election times, depending on where we are in the world, connecting users to also the polls. So it's a very broad range of types of messages that we can do. And I think here, the key thing is building trust. Building trust through these partnerships, because we know that without trust, the community won't show up. And we want them to show up. We want them to take care of themselves. And that starts through platforms like ours. Next slide. And how does these messages work? Once you have the pop-up message come up on your screen, that red button that you saw before immediately takes them out into whether it's a Google form, Facebook, social media platforms, even WhatsApp, to schedule then their test, or even ask a peer navigator a question, right? So we have a lot of flexibility here to be able to go from our platform to yours and get them where they can taken action about their sexual health or about anything else that's happening within the community. Next slide. Another type of space that we also offer is the inbox message, which was the middle section that you saw before. And here it's an opportunity to deepen our partnerships by creating large campaigns, which have, design aspects to it. This one in particular was during the holidays when we were talking about violence in the home, right? But we've done quite a few. Next slide. Around free HIV home test kits that get distributed in the United States, for example, solidarity campaigns, safety campaigns, and even mobile clinics. So these are things that we can use as well to show what's going on in their local community, and folks can show up. Next slide. Another resource that we also offer is in the side drawer, which is a permanent link that resources can live 24/7. This means that any users can access this for a variety of items. And one of our flagship programs is HIV self-test kits, where a user can automatically order a kit directly to their home or their preferred place in just a matter of a few minutes. We have various partners, and specifically in the region through Namibia. Right now, the program is paused, of course, due to funding issues. However, the way that we always operate within these partnerships is that we check in with our local community to see who are they going to. Is there a clinic in particular that they trust, and navigating those partnerships again with trusted community leaders to make sure that these are also partnerships that we can build bridges across communities and safety and health. Next slide. And for us,
would you mind wrapping up in the next short while, please?
The last slide.
Thank you.
And today we work with over 300 partners worldwide. And for us together, we've been building one of the most effective conduits for reaching LGBTQ people with life-saving information. We truly believe that the app is more than just a platform for connection. It's a lifeline. It's for empowerment, safety, and, we invite you to send us your questions, partner with us, and bring your resources into Grindr. Next slide. And here's my contact information. Open also for any questions or follow-up meetings after. Thank you so much.
Thank you, Steph. That was really innovative and super interesting. And yeah, I'd encourage our audience to reach out to Steph or sign up on Grindr and take a look and get to know a little more. So we'll move to the next example, which is Orange. For this presentation, I'm going to introduce Rakaya Solange, who has 20 years of experience in the telecoms field. And joining Rakaya will be Ralph and Zamilia, who will also be contributing to this example. Just a reminder to the audience, please select English if you would like to listen to this presentation in English. Rakaya, over to you.
Merci. Donc, moi, je vais faire la présentation en français, en attendant que Jamilia puisse se reconnecter. Donc, c'est une présentation du groupe Orange, qui, comme vous le voyez sur le slide, est présent dans 26 pays en Europe, en Afrique et au Middle East. Donc, Orange, aujourd'hui, est une entreprise française, un opérateur, qui délivre des services aussi bien, comme je l'ai dit, un peu partout dans le monde. Nous avons un réseau d'environ 291 millions de clients à travers le monde. Slide, s'il vous plaît. Alors, nous sommes très actifs et engagés dans tout ce qui touche à la santé et notamment au digital et à l'innovation, dans la mesure où nous avons un partenariat de longue date avec les différents gouvernements des pays dans lesquels nous travaillons, les institutions et les différentes structures qui travaillent dans tout ce qui est système de santé. Et ça nous permet aujourd'hui de déployer de nombreuses solutions, des plateformes en partenariat avec ces différentes parties prenantes-là, du secteur public, de la société civile, pour lutter contre différentes maladies. Et ici, vous avez donc quelques exemples des partenaires que nous avons, notamment Gavi, The Global Fund, the World Health Organization et ce qu'on appelle Datadog. Le slide, s'il vous plaît. Donc, je vais faire une présentation de M-Diabet qui a été déployé au Sénégal. Le Sénégal est l'un des pays pilotes du programme mondial Be Healthy, Be Mobile, lancé par l'Organisation mondiale de la santé, l'OMS, et l'Union internationale des télécommunications. L'objectif est de démontrer qu'il est possible de mettre en place à grande échelle un programme efficace de lutte contre les maladies chroniques grâce à la téléphonie mobile. Et dans le cadre de sa lutte contre le diabète, nous avons travaillé avec les ministères de la Santé et de l'Action sociale au Sénégal. Donc, le M-Diabète est une solution qui permet aux individus de recevoir des SMS de sensibilisation et d'information en s'inscrivant sur un numéro court. Et l'objectif est donc de permettre au plus grand nombre de pouvoir bénéficier de ces informations-là. C'est une campagne qui tourne autour de 3 phases. La première phase est l'envoi de SMS à toute la base Orange prépayée avec un message qui les incite à s'inscrire. Donc, la deuxième phase consiste à l'inscription des personnes qui le souhaitent afin de recevoir les conseils. Et la troisième, c'est donc la réception des SMS. Et c'est un programme qui nous a permis de toucher un certain nombre de personnes, notamment au Sénégal. Lorsqu'on regarde les KPI, il y a 400 000 personnes qui souffrent de diabète, mais seulement 40 000 de ces personnes-là ont été diagnostiquées et reçoivent un traitement. Donc, une solution comme M-Diabet permet donc de venir apporter une réponse concrète en impliquant le secteur privé, des outils comme le numérique et le digital pour apporter des solutions atteintes de cette maladie. Donc voilà, je vais passer la main à Ralph.
Sorry to
So we, when I was working in Orange Middle East and Africa, working in partnership with Global Fund and Gavi, and we co-design and co-create. We've co-found in kind for private sector some of the projects. So we realized with Gavi that's a lack of, I would say, acknowledgement of the vaccination for the mother to vaccine the child. So we create the platform to send a SMS to the mother, pregnant mother and newborn to help them to vaccine their child. So we send this SMS to sensibilize the pregnant woman and the woman, the mother, to vaccine their child. So this project was, like I said, co-founding and co-create with the Ministry of Health and Gavi. So it was a long commitment and partnership with Gavi to push this solution. And now it's still working and promoting and not promoting, sensibilize for vaccination is very important for the child. Next slide. So this also one of the partnership we have with Global Fund, working also together on some country. One of the country was Morocco. Actually, we have 2 countries with Global Fund, one in Ivory Coast and one in Morocco. So Morocco, we start the partnership with Global Fund, similar process, similar commitment with the co-founding, co-creation with in-kind on our own sites. So like we work closely with Ministry of Health to answer to the needs and the problems. So actually, we went on the field to interview doctor, interview nurses, and all the team from the MOH to figure out and explore what their needs and what the lack for the ministry. Concerning the Morocco, there's two problems. One is the connectivity. So we installed a optical fiber to the health center. And the other end, we developed tailor-made application for, I would say, stock management, medical stock management, to track and to follow the stock medication stock management to make sure that some of the we went on the field and we figured out some of the medication was out of date, so that's kind of problem we avoid when we have the kind of digital application on the mobile and the PC to manage the stock and to make sure there's always the stock and follow and track the I would say the date over of the medication. So yeah, so like the similar thing, we really work closely with the team, Global Fund team and MOH to develop this application. Next slide. Oh, over. So sorry. So just I want to finish with this. I mean, this kind of collaboration partnership is very important. Like I said, we scope found, but beyond this, when you set up all the application, when you set up the tailor-made application and access, etc., you have to make sure that this project is continuous sustainable. And that's the big challenge for us, that to be you have the sustainability. So we have, after that, we have always trying, even if Orange co-found, with in-kind, at the end, at the long term, one, we're not able to co-fund for the long term after the project was set up is very complicated. So the challenge is to find a new partner, funding provider, or to leverage a new program with a partner always, because in the health sector it's very complicated to have funding, and now it's getting more difficult after the UHL dismantle. So we have a lot of projects with USAID, and now it's very complicated to leverage more fund. So that's kind of challenge for us, but we keep going and try to leverage some more fund for and partner. Sometime in some project we need to have a more private partner, CSR or overfund private partner to co-create with the partner on the health sector.
Thank you so much.
Thank you very much. Bye-bye.
Thank you, Ralph and Zamilia and Rakaya. Apologies about the... Yes, Francis.
No problem.
Thank you.
Understand.
No problem. So apologies to the audience for the slight disruption in translation or interpretation, but I believe we are back. And thank you to the team, to Team Orange, for being flexible. So I will move over to our last example, which is from MyShemeds, and I'm going to invite Cici to come. Cici leads strategy at this at MyShemeds and was formerly a partner at BCG. And yeah, Cici, over to you for our last country example.
Hi, everyone. Thank you so much for your time. I want to talk to you about our perspective as a private sector innovator. So MyShemeds is a healthcare technology company. We were founded in Kisumu, Kenya, and are now operational across Kenya, Uganda, Tanzania, and Nigeria. Where we focus is on community pharmacies, drug shops, and clinics that are the first point of care for the majority of people across our countries of operation, especially for that first line care, especially if you're presenting with, a headache or a fever, and especially if you're in a more peri-urban and rural area where that might be your trusted community provider. So our founder and CEO is a medical doctor who was practicing in a government facility in Western Kenya, but realized that in reality, many health systems are quite mixed. And if there's ever a stock out, the doctors ask patients to go to the nearby pharmacy to pick up the meds and come back, but that in the past has sometimes led to a lot of loss of follow-up. So instead of saying, oh, this is such a problem, the private sector is a problem, what if we turned around and asked, well, what are the needs of those pharmacies, drug shops, and clinics? How do we improve the quality of care that's provided there? And who are the patients who prefer to go there? How do we solve for their needs? So that's how Maisha Meds was born. I'm not actually sure why the slides here have off formatting, but doesn't really matter. Let me tell you a bit about the different parts of our solution. So on the left-hand side, you can see there's 3 parts to our technology solution. The first is that we built Android-based business software precisely for those types of facilities. So imagine a small business, a small shop, a drug shop, a pharmacy, a clinic in a peri-urban or rural area of Kenya, Uganda, Tanzania, Nigeria, many of which are women-owned, run by nurses or midwives, or a pharmacy owner and sales attendant. They previously used pen and paper to manage their operations, but now they're able to use our software. And again, our software is free to download and use off the Google Play Store. We do not pay our pharmacies to use the software. They don't pay us. It's really something that's embedded into their everyday workflows to help them make sales, manage inventory, track their patients, check profit and loss. And the average pharmacy that uses our software actively after a year sees a 24% increase in their revenue. And that's just because it's easier to measure and manage what you can track. And we have about 5,000 pharmacies, drug shops, and clinics across Kenya, Uganda, Tanzania, and Nigeria, enabling 26 million patient visits a year already across our network. But we didn't stop there. Once we had that software in place, you could see real-time data coming in from the private sector from the last mile. And it exposed to us many things that may be familiar to people on this webinar, which is that you see a lot of antimalarials being dispensed, not necessarily a lot of tests. You see a lot of emergency contraceptives being dispensed, not necessarily longer acting methods. And so we then said, within this same app that already the pharmacies are using, so you do not have to ask them to change, their behavior necessarily even more. What if we layered on some clinical decision support? What if we ensured on the back end there were supply chain for high quality WHO pre-qualified commodities? And what if we make sure there's sort of an auditing and claims management back layer? Can we then enable these providers to improve malaria, HIV prevention, HIV treatment, women's health, and vision care? And the answer is yes, and I'll speak about that more on the next slide, but that's our patient support programs. The only other thing I'll mention is that the data that comes through from our software, it's not just valuable to us, right? Maisha Meds can't solve every problem, nor should we. We do make sure that we share our data in anonymized, secure ways to the governments across our countries of operation via DHIS2 integration. And we also have commercial data products that we build, such as our anti-malarial consumption tracker, that different nonprofits, global health funders, and pharma companies access to make policy and program and investment decisions. So that's Maisha Meds. Next slide, please. I want to touch a bit more on our patient programs. Again, I'm really sorry for the particular slide format. It's a bit different from, I think, what we might have sent, but maybe I'll walk through what you would imagine, I guess, is the principles from which we design our patient programs. So the assumption here is that if you're a patient, you're already coming into this pharmacy, right? So we would want to make sure that the HIV or the malaria care you're receiving at that pharmacy is higher quality, but more affordable. And so what we typically do is structure that flow to be a really good experience for the patient, to make sure the counseling is improved, but to also make sure the end price you pay is less than or equal to what you would have otherwise expected to pay in the private sector. On the pharmacy side, we want to make sure that they have, again, sort of within the same software, the nudges or clinical decision support and the back end kind of supply chain to deliver that higher quality care. You know, they verify a patient, they make sure they test before treating for malaria, they make sure they test for HIV before offering different potential HIV PrEP options or PEP options. And only when that care is provided and validated via AI-enabled auditing and claims management processes are they then reimbursed for that quality care. And so part of the ethos for that is we wanted to make sure that pharmacies, who after all are running a business, that their pro-social behavior, their desire to provide high quality care to patients aligns with also their financial needs as a small business. Because only once you have that in place can a program like this potentially scale. So I wanted to share a little bit of this ethos. And what you don't see on this page is the payer. All of our patient programs are paid for by outcomes financing contracts, either by government social insurance schemes or by global health funders. And we need to make sure the service delivery cost of how much it costs to pay MyShemeds to deliver this quality assured care is significantly less than what you would have paid for a historically donor funded program, because otherwise it's not cost saving and also isn't good value for money for the payer. So those are the three elements we design every patient program with. Next slide, please. And we've had success in doing so. So as I mentioned, we've reimbursed more than 1 million patients via quality assured outcomes financing contracts. This is for malaria, for HIV prevention and treatment, for reading glasses, for women's health. And we know that the care we're providing is improving patient outcomes because we've validated all of our patient programs through multiple randomized control trials. For example, we show that we can improve malaria testing before treatment by 4x. For HIV prevention, we can demonstrate that patients increase their PrEP uptake by 7x, but the cost of the service delivery to MyShemeds is a greater than 50% cost savings compared to historical donor-funded programs. So happy to share more about that. Won't get into the details here in the interest of time, but it is really important to us that everything we do is backed by objective impact evaluations to really show that that care is improving, but then the value for money for the payer, whether it's government or a global health funder, is significantly better. And I want to end off by talking about the next slide. As an innovator, you know, as MyShemeds, like for us, it's really not about the public versus the private sector. It's really about bringing the private sector online, making use of all the healthcare infrastructure and capacity that exists, and allowing, you know, the public and private sectors to be a bit more integrated. And in order to do that, there is no scale and sustainability without government. And so we have now reached a point where I think I want to highlight two partnerships that are deeply exciting for us, where the government is co-creating with our model or with our technology, how they wish to deliver care between the public and private sector and resourcing that with domestic financing. So on the left-hand side, you know, I want to highlight that the Lagos State Ministry of Health is leveraging the MyShemeds platform to deliver malaria and fevers care through PPMVs and community pharmacies in the state of Lagos, and also using those PPMVs and pharmacies as enrollment sites for the state social health insurance scheme, making sure that malaria care is delivered where people choose to seek care. But if it's not malaria and if it needs to be referred to a higher order public facility, that linkage is made. And again, the affordability and sustainability piece is there because we're linking patients to the health insurance scheme. So that's a really exciting piece of work. And then on the right-hand side, I want to highlight another partnership that we're really fortunate to be supporting, which is is that the government of Uganda is one of our longstanding partners, and through a catalytic investment from the Global Fund, we are able to explore the AMDIS project, which is Alternative Mechanisms for Delivering Integrated Services. For the first time, publicly procured commodities will be allowed to flow through our private channels. And the idea there is, can we make sure that we have kind of the optimized data, financial, and product flows to ensure that malaria test and treat can be done well through the pharmacy channel, and that HIV prevention services can also be provided through the pharmacy channel? And can we know and understand more about patient willingness to pay, what copay models make sense in the private sector, and do it all in a way that can inform Global Fund's GC8 as well as Government of Uganda's future planning on how they will be able to allocate some of their domestic resourcing potentially to alternative service delivery channels where patients seek care. So that's another piece of work that we're extremely appreciative and honored to be undertaking with the government and with catalytic investors such as the Global Fund, which David spoke about earlier. So I'll end with the last slide, which is to say, like, I just think this webinar is so on point, and we're really honored to be sharing some of our perspectives. I really think we're at a unique moment in time where, you know, there's a lot of openness to think about how health systems are designed and financed for the next, you know, years and decades to come. And if there is more interest in learning, not just about our model, but about outcomes financing in general, and how philanthropic investment can unlock government resources, and how we're partnering with governments and philanthropies to do so, we are hosting a closed door event at UNGA next week that will be featuring the head of NASCOP for Nigeria, other government speakers and funders, and we'd be happy to have you if you're interested in attending and continue the conversation there. Thanks so much.
Thank you so much, Cece, and thank you for the invitation. I encourage anyone who will be there and interested to join, and and congratulations on some really exciting work that you shared with us through your presentation. So we have one more speaker before we'll open up for some question and answers, and that is Sibongile Shabalala, who is an HIV activist and the national chairperson of the Treatment Action Campaign. Sibongile, is from South Africa. She's bringing the voice of community, and we welcome you, Sibongile, to share your reflections and any calls to action that you have based on what you've heard in the webinar to date.
Thank you very much, Kerry. I'm sure I'm audible. Can you confirm?
Yes, you are.
Thank you very much. And unfortunately, I don't have a presentation. I don't believe in presentation. I believe in talking so that people will listen to what I'm saying more than looking at what I'm presenting. I will start with the experience of Treatment Action Campaign. I think most of you in the webinar, or most of people, they know Treatment Action Campaign. Treatment Action Campaign is an organization that fought for people living with HIV in South Africa and made sure that we have ARVs. And in the early days, our fight started with the government, and later we joined the government to fight pharmaceutical companies in terms of making sure that we have ARVs in South Africa. Over the years, Treatment Action Campaign has been engaging or challenging and advocating for quality healthcare services. We never had a partnership with a private sector other than those who were funding the work that we are doing. However, I want to just focus more on what is really happening now. We have seen the private sector coming up during COVID to support most of the work that we are doing as community organization. However, on the ground, there's still that lack of transparency and trust between private and communities. This happens because in most cases, we know that private sector, they only look at the profit, while us as communities, we are working on the long term-based solutions and want to invest in community engagement and community health. So in most cases, it becomes very difficult for us as communities to continue to trust private sector, because most of the time when they come and work with us, their demand are very difficult for us as communities. I would just want to make a typical example now here in South Africa. The government is trying to initiate a one healthcare system, but we have seen several private sector taking the very same government to court. We are not against that. But the question that we always have, what is the community voice? What are they thinking about the community? And we took a time with our partner Section 27 to look at these cases as treatment action campaign, and we find out that all these three cases that are in court, most of them, they're not talking to what community the community needs, what NHI will benefit, how NHI will benefit or not benefit communities, but it talks about how private sector, they are protecting their profit, how they are protecting, how they use private sector to gain more money in terms of health provision. So as treatment action campaign, we joined one of the cases as friends of the court, because we thought that it's very important now to bring the community voice. Yes, NHI is not perfect as we will like it to be, but we believe that it's something that might bring change and might improve the healthcare system in South Africa. So I'm trying to raise the voice to say we are working with private sector, but in some instances we find private sector not thinking about us as communities, but they only focus on their profit and how they are making money out of that. My colleague here from Global Fund has touched based on how Global Fund now is trying to make sure that Lenapakave is available, and what role the private sector is playing. Unfortunately, Kerry, I'm coming here as a community voice, and I won't shy away, or I won't be nice in terms of responding to how private sector is bullying communities, especially communities that are coming from low middle income countries. In terms of the land accessibility, we as communities, we feel like we are robbed. We feel like we are not consulted enough by both Global Fund and our governments in other cases. Like, for instance, in South Africa, Global Fund has donated 29 million US dollars for South Africa to be able to access Lenapakave. But when we try to engage to say, how is that money going to assist communities, or that Lenapakave is going to assist communities, we find out only not even a portion of community of people living with HIV will be able to access land in the next 2.5 years. So that means it's not for communities, but it's for them to make them as if they're doing something for communities, while it's not for us. When we engage with Global Fund to say, at how much are you buying Lenapakave from Gilead? They can't tell us the price because they've signed a non-disclosure agreement with Gilead. That it's a problem for us, because our countries won't be able to buy Lenapakave directly from Gilead because it's patented and it's very expensive. I'm making this example for communities for people to see, to say we as communities, we are always left behind when there are these conversation between private and governments. And at the end of the day, the benefit is not for us, it's for them as political stunt, it's for them to give each other businesses, and they sign this non-disclosure agreement on our behalf without even engaging us. That is not fair, and that is not for us as communities. So that's where the issues of trust and transparency, they are coming in. And lastly, I think, Kelly, what I need to talk about, to say how can we engage, or how can we work together, communities and private sector. One, we need to build trust amongst ourselves. We need private sector to design or co-design any initiative with us. They need to involve communities from the start. We cannot be consulted at the last stage of the project, but we need to be consulted from the start. We need private sector to support the NGOs, especially now that we know that the US funding is no longer there. We were expecting to see more of private sector coming to NGOs and saying, how can we help you? And now we are finding ourselves, our work, it's very like compromised, because even the 29 million that we are talking about from South Africa in interest, it has to be taken from the existing grant, and mostly the community work is the one that has been deprioritized, so it's mostly affected. So that is why we are saying we need to have that trust and transparent capacity building.
Yeah.
They always challenge, say we are not capacitated enough. We need private sector to work with NGOs to capacitate NGOs in terms of how they do finances, in how they build long-term capacity to sustain their programs, and also how to negotiate future partnerships with them. And also, I think that working with private sector, it will be very important for us, and we can get something. And also working with our government in terms of making sure the buildings, health hospitals, all the health facilities are serviced as well as they can. I know people who are living in South Africa, they can tell you there's a huge difference, the public and the private. Thank you very much, Kelly.
Thank you, Comrade Sibongile. I'm so glad you were able to join us today and say it like it is from the ground. And I think we always appreciate that. What's interesting for me to hear is that the themes are common. The themes of trust, the themes of choice, the themes of impact, the themes of co-creation. But I think somehow we share the right principles, and we share a kind of this shared value, I think, that David spoke about, but somehow we are not yet finding one another entirely, it seems. So I think it's really great that we've had this diversity of voices here today, that we've identified some of the disconnects in some ways across how these private public partnerships are seen and experienced by all the different stakeholders. And I really just want to thank everybody for sharing their point of views. And I think, you know, I hope that this will help us move forward after this webinar, which is really just a webinar. But I hope that some action and some real conversations can take place moving forward. So we'd like to use the last 6 minutes of this webinar just to open for some question and answer. And I would like to ask Dr. Onyekachi if he will just spend a few minutes facilitating Q&A, selecting either some from the chat box or the Q&A box, or any of the other, if there's any hands. So over to you, Dr. Kachi.
All right, thank you very much, Kerry. I hope you can hear me loud and clear.
We can.
Awesome. So I believe everybody will agree that this has been a very wonderful webinar. It was eye-opening, a lot of innovative initiatives, and of course, Sabongile with that very passionate appeal. I was with her about 2 months ago in Zambia, and I can attest to the fact that she is very passionate about her work. So without further ado, I do have quite a couple of questions that require to be answered. And just like Kerry did mention, majority of the questions seems to revolve around trust, transparency, guardrails to avoid profiteering. So there was a question that I don't think was initially answered, and that's from Moses. Moses was asking to the last mile team, what role, if any, have pharmaceutical manufacturers and companies played in the program? And I believe is the CCMDD program. Now, the second part of that question is, are ARVs available in the private sector? And do you think it's feasible to have a private sector model for those who are able to afford it. Over to you, Phil.
Thank you for the question. I think the uniqueness of the South African model is that the medicine belongs to the Ministry of Health. And all the private sector is doing is providing a pickup point through its dispensary for the medicine. So it's a very much a closed loop system. The medicine, it's prescribed, it's packaged by a courier company, pharmaceutical courier company, and delivered to the pickup point where the patient collects. So the only interaction that patient has with the dispensary is to prove his identity and receive his medication. It removes any kind of transaction within the patient or the private sector. It's always the government medicine, and that's why the controls are so tight. I hope that answers the question.
All right, thank you very much, Phil. So given that we don't have a lot of time, I'm going to have these two questions directed to Esther and David. And it's about one repeated issue: transparency, guardrails, trust, ongoing engagement with the community teams. So the question is, how do we build trust between government and the private sector? What are those guardrails we can put in place? And that's coming from Lucy. And it's not just Lucy, it's also coming from, of course, you heard from Sibongile and a couple of other persons who also asked the same question. And if you look at it, that seems to be the concern of most people. What are the guardrails in place to ensure that clients, the end users, are not exploited? So over to ladies first, in this case, over to Esther.
Yeah, thank you so much. And Lucy, I did provide a response also in the chat, and I think I'll stand by that still, just to say that I think transparency is really important when we're setting up these partnerships. So being able to be explicit as the government around what success looks like, what are your objectives, and as the private sector, also being able to come in and share transparently what your objectives are, in a way that allows us to be able to create partnerships that will be sustainable in the long term. So it doesn't help if we're meeting all the objectives of the government, but we're not meeting the objectives of the private sector. And it came up a few times also in the chat around the profit aspect of the private sector. Yes, this is one of the areas that the private sector cares about, but I would refrain from us overly focusing on the profiteering aspect of the private sector. That is just one of the functions of how they exist and how they're able to make themselves sustainable. But if we're able to bring in partnerships with that focus of the core objectives and being clear about that from the onset, I think that helps us to create those long-term partnerships. And I would also put it, particularly on the government side, the onus being on them, particularly to bring in the community voice and the community lens as well. Once again, the private sector isn't as privy to how our systems work in the health space. So we should put that onus on the government to ensure that they're bringing in the perspectives of the community. And I'll pass it over to you, David, if you wanted to add anything else.
Yeah, thanks so much. Just to perhaps build on your point, I think a couple of things. One is, I guess, process of country ownership, and it's the process of that is not just the implementing partners, but the patients affected by this, the communities affected by. So whatever partnership you're going to build, you need to have that kind of patient perspective and the community-based perspective built in, because it needs to have that buy-in and it needs to be sustainable. The private sector knows how to do this very much. They build solutions that nobody probably needs, but we're all surrounded with, whether it's our phones and all that. So there is, and they make a profit out of it. As you're negotiating partnerships in this health space, it's very important to make sure that, you know, there is a motive there to serve people, but it's also within this kind of greater good. And if you look at the most advanced companies, the ones who are the leading brands out there, they have that community engagement. They want to engage with their communities, whether it's their customers or future customers or people within that. And providing a very clear and transparent way with which they can engage for good, not necessarily selling for only for profit, but thinking about sustainability over the long term. that is the essence of a long-term partnership. Over.
All right. Thank you very much, Phil and Esther. I'm sorry, David and Esther, for your responses. And I believe we're at the top of the hour, or well, top of the time for us to move to the next. Can I just squeeze in one more question?
I'm afraid I don't think we have time, but what I would
Yes.
love to say is that I hope there's not only one more question. In fact, I think it seems clear to me that a whole lot of people have got to know each other today. I, for one, can say I don't even know all the panelists, and that's my first time, and it is such a privilege and pleasure. I hope through Sequin and through the SSLN and the BCA that this network that has begun on this webinar may start some things, whether bilaterally or in network settings, as we are learning networks after all. So yeah, I'm so sorry, Dr. Kachi, but I hope that, you know, through the Sequin meeting that's coming up, through future SSLN activities and through the BCA, that some of these great innovations can be further engaged with, maybe replicated, that there's opportunities to bring some of the different stakeholder groups together. You know, we have government here, we have community. I think we have about 20 countries represented in the audience. And really, I suppose my last call to action as I close this webinar, because we are 2 minutes over, is to encourage the panelists and also the audience here to take forward this discussion, and we might come back in a similar virtual format or others. But what I really just want to do is take the opportunity on behalf of the hosts and thank you so much. And I'm sorry we've run out of time, but yeah, just wishing you all a wonderful time and thank you so much. Over.
Thank you all.
Thank you all.
Very interesting, and yeah, maybe
Thank
talk
you.
to you later, or yeah, another condition. Bye-bye.